There we go. Okay, so I'm so excited about this topic because this is a topic that is really near and dear to my heart as well. So we're super excited to have Dr. Ashley Fischer here. If you don't know Dr. Ashley Fischer, she is Peoria native. So she's from this area and she finished her medical education at University of Illinois at College of Medicine right here. Leaning into those homegrown roots, she stuck around. She did her pediatric residency at the Children's Hospital in 2016. After that, she established her outpatient pediatric clinic in Pekin, Illinois, and she still practices to this day. And she has a strong interest in mental health and then also LGBTQ plus healthcare. So thank you so much for presenting today. We really appreciate it. I'll let you take it from here.
All right, that's like assuming I'm going to be able to figure out how to share my screen on here. So perfect. Okay. Fantastic. All righties. Good. Can everyone see the slides, right? Perfect. All righties. So I am so excited to be talking tonight. Thank you so much for having me in here because like she said, I do love ped psych, and I just love helping parents. I'll be honest. That's one of the biggest reasons I got into peds, because there are some really basic stuff I'm going to talk about tonight that was pretty life-changing in my own life. And so when it comes to credentials, when we talk about like behavioral changes and behavioral therapies in kids, we honestly don't get a lot of it in residency or med school. I'm going to be honest. We do a lot of like the medical side, but they don't do a lot of like how we can do behavioral change on things. And so where most of my education came from was reading and then having kids. Like I think that's like the best educator of all, right? Is having my own problems with my own kids and then trying to seek out answers from them. And so I've read quite a few books with that. And this is, I have to have this on all my slides, but no financial interest to disclose. Quite a few books on that. And something I have come to learn, and I think that we all need to start off with is two assumptions here. Okay. So going into this presentation, there are two things we are going to hold true. One is that the perfect parent doesn't exist. Okay. They don't. And the second is that no one is born knowing inherently how to parent. Okay. And I think that's something I feel like we should have, right? Like we should just know how to be a good parent. But why that and nothing else? And so how do we learn anything else? How do we learn to play baseball? Do we come out of the womb knowing that? No, right? Someone maybe taught us, someone that had played before us or knew better than us. Maybe we read books, maybe we practiced, maybe we joined a team. You know, there are different ways to learn different skills, and communication with kids, how to be a good support system for them and how to parent should just be one of them that we accept should probably be learning kids, right? So there's kids with different temperaments. Some are going to be hyperactive, some are going to be chill. Some are going to be emotions right on their sleeve. Some you really got to dig them out. And those are all going to lead to different behaviors, which then we have to understand that all those behaviors have an underlying reason. Okay. We just have to figure out what that reason is. All right. So, second assumption. So let's talk about the childhood brain. I think this is just going to help us going forward, just like a little basic understanding about how a pediatric brain works. Okay. So we have frontal lobe, that's up here. This is going to be your personality and your decision making. Okay. Decision making being the important one we're going to talk about. The amygdala is not on this picture, but it's in between the temporals. So like right here, kind of in the middle of the brain above the midbrain. This is your lizard brain. That's what I call it, our tiny little lizard brain. So this is where we get emotions from, stress from, and then our fight or flight response. Okay, this is what keeps us alive. We then have the temporal lobes, okay, on the sides. This is your memory. That's going to be the important one for this. And then not as important for today's speech, but parietal does that, and then occipital lobe does vision. Okay, so then we're going to talk a little bit about the stress response in children. So first, we're going to have a perceived threat. Right? So to get a stress response, some sort of perceived threat. Now, in an adult or in like evolutionary terms, this used to be like a lion, right? Something that is dangerous to us that then gets our body ready to do something about it. But for kids, it doesn't have to be quite that severe. This can be just as simple as an adult they don't know very well because they can't predict their response and they're not sure how that adult is going to respond to them. Perceived threat. So then what happens next? So the one that everyone thinks of, right? Fight or flight. And so kids actually have a third one. So it's fight, flight, or freeze. And then I really like this graphic because it talks about what does that look like, because it is a little different in kids, right? So I think fight is a pretty easy one. Okay, so this is the kid that's yelling and screaming and hitting and is, no, I won't do that, and very oppositional defiant. Okay, fight, right? So flight, though, I find a little interesting because I think we naturally think of flight as running away, right? So physically running away, but kids can't do that, right? Like they can't leave the home, they can't leave that safe environment. So their flight actually tends to look as internal flight. And I think once you start thinking of it this way, it's going to be a lot easier to understand some of their behaviors. So this is where they aren't paying attention to you, basically. They have internally regressed in their brain. They are not wanting to listen to what you're saying, not doing the things you've asked them to do. They're difficult to corral, basically. And if you start thinking of that more as flight rather than defiance, it starts to make a little more sense. And then freeze is exactly what it sounds like. So just those kids that literally just stop responding. They just completely shut down. I have a lot that will do the I don't knows, right? Well, why did you do that? I don't know. Well, what were you thinking? I don't know. And just over and over again. And this is actually kind of a combination of that flight, that internally shutting down, as well as that freezing. So that stress response, then, let's talk about how that can correlate with young children that have gone through something that we call ACEs, okay? So adverse childhood experiences. This term came out of a really good study done in 1995 that was looking at how childhood experiences can alter brain development as well as development in different children. And in that study, they identified 3 different kinds of adversity that can have some sort of response in this ACEs category. And so that's physical and emotional abuse, which I feel like is one that we think of quite often. But they actually found that neglect, so this can be emotional, physical neglect, and then just household dysfunction. So basically a very chaotic household can actually have the exact same kind of developmental and physical effects as that physical and emotional abuse. So the accumulation of those events, right? So one event will cause a activation of that fight or flight system, right? That stress response. So if we have mom and dad yelling at each other once, whew, stress. I'm stressed, but then they make up and now we're all going to go to movie night. That stress backs off down, right? And so that is not going to be the definition of what we're calling toxic stress. That's kind of a normal stress experience. What happens with toxic stress is when their body is on alert 24/7. So this is an environment where they're always yelling, right? We're never sure what's going to happen. I have to be on alert all the time because danger or some sort of need may not be met at any point in time. So does that kind of make sense how that would like play into those 3 times of ACEs, right? So obviously a violent household, you're always going to be on alert, right? You're always going to have that stress activated. You have neglect, you're on alert because you're looking for survival things, right? So whether that's food, whether that's companionship, you're on alert trying to look for those needs that you need to have fulfilled. And then, like I said, chaos is what we just talked about. The parents yelling, always alert. When you can't predict things, you're constantly on alert for that stressors. So positive stresses, which is the first one we talked about. So these are those like short-lived ones. So when a toddler jumps off of a couch and you know that like second right before they're going to hit, when you have that panic, like, oh God, this is about to happen. That is a short-lived positive stress, right? Because right afterwards it's relieved. So either have something happen or they did, and now we high stress, and over time they learn that it doesn't need to be quite that high stress in that moment, and that is from learning by having the experience over and over. So these are good things. However, like we talked about earlier, having that activated all the time is almost like a poison to the developing brain. Okay. And in the absence of something to help bring that stress down, to have some sort of adult support to help them manage that, it can actually really affect the structure of that developing brain. And I'm going to show you here in a second what that looks like. I just find this really interesting that 90% of a child's brain development happens before age 5. A lot of people don't realize that, but that's why that childhood is so important. And so, kind of trying to I tried really hard to keep this presentation really relatable on a number of different spectrums and not really hone it in just on foster kids. But I am going to talk a little about when you have like a child that you're bringing in. If they are older than 5, I think it's just important to remember this, that 90% of that brain development has kind of already happened. And so a lot, like, it's not that we can't make a change or anything. It's just that a lot of those behaviors are not going to be 100% in their control because a lot of this happened when they were younger and that brain was developing. So when you look at what the actual structure of the neurons look like, so this is comparing the normal child brain to a brain that has undergone that chronic toxic stress. And the things you can see here is there are significantly less connections, right? And so that bottom picture has much less color. It has way less branches to it. And then when we even zoom in on the actual neuron, you can see how it doesn't look as frayed. I don't have a better word for it, but like all those little nubbins on the side, those are new neurons. Those are new neurons that are growing, and the toxic stress brain has significantly less. So we're actually seeing this on an actual anatomical level. And so then what that study did is looked forward to what does that lead to, right? And it found that children undergoing toxic stress are more likely to have problems in learning, behavioral problems, and then even physical problems. So more likely to have diabetes, more likely to have heart disease, more likely to have obesity, and some of these other things that come with chronic health conditions. So how can we be that supportive adult presence, right? So that's what we say, okay, toxic stress is bad, I'm convinced, right? How can I help alleviate that for the children in my care, right? So here's where I'm gonna go into, like I said, this one's gonna be a much more basic overview of the advice I tend to give to parents on how to communicate with children and on how to approach certain situations to help children feel supported and to help children grow resilience. I've read a lot of books on my journey to parenthood. Like I said, yes, as a doctor, but also just on my journey to parenthood, learning how to deal with some of these situations. And I'm going to be honest, a lot of it is going to come from my very well loved copy of this. Okay. So I brought it so that you could just see how well loved and ripped up this is. And it's called How to Talk So Your Children Will Listen, or so your kids will listen, and listen so your kids will talk. It's a quick read. I get it done in about like an hour and a half. And I've read it 3 times, and I have 3 children, and that is not a coincidence. And so there is some flat out plagiarism in here, I'm going to be honest, like for some of the things from in here, because they are really that useful. And so the first one that I really like is from one of the first chapters, and it is how to help children deal with their feelings. And the real other thing I really like about this book and about some of the tips I'm going to give you is they are applicable across all child ages. So you're going to kind of see as we go along that toddlers are not actually that different from teenagers when it comes to some of these tips. And this can be pretty useful in all those different age groups. So helping children deal with their feelings. I really like these 4 steps. This is actually a comic in the book, and it helps me remember them sometimes on what to happen when you approach a situation with an upset child. So first is to listen quiet and attentively. So sometimes I do have to remind parents that kids like can see and hear and interpret a lot more than we think they can. And a lot of times that interpretation will be something we didn't think they were going to take it as. So if you are quickly glancing at a text on your phone, but the child is upset and trying to like hear you, you are giving the message that you're not listening to them, and they don't have the emotional maturity enough to understand that that's what's going on. And so I usually like, I'm going to walk through examples from my own life, that she has fallen. I have my 4-year-old has fallen, she has stubbed her toe, and she is crying her brains out, right? I sit down, I grab her hands, I make sure she knows she have all my attention, right? And I go to the next one, give that feeling a name. This is really good for young children. So young children do not have the vocabulary yet to express a wide range of emotion. So when they have these big feelings like anxiety or depression, they can't put a name to them, right? It means nothing to them. It just feels big. And so by helping give them a name, we're helping not only build that vocabulary, but you'll be shocked by how much information comes back to you from them. So for instance, if I come up and I go, oh my goodness, you look so sad. And then Sophie yells at me, I'm not sad, I'm mad. And it's, oh, that's new information for me, right? This is more information for me to understand what's happening there. And so the next is then to acknowledge with an open-ended response. Okay, so when we give information, you are implanting ideas whether you mean to or not. So if I say, are you mad because this happened? Now maybe they are. Maybe now they're like, I didn't even think about that. Now I am mad that happened. And they're never going to tell you what the actual like problem was. Does that kind of make sense? So going with that analogy, so I come up and I'm like, okay, oh, you're mad. Oh my goodness. Can you tell me more about that? That's the one I use most often. I feel like it's a very easy one that applies to all situations, but you can also, and then just sit in the silence. And that's really hard to do sometimes, I think, especially as parents. But the kids want to fill the silence as much as you do. And so by doing that, you're going to get more information from them. So when I go, oh, tell me more about that, she says, Connor left his toy on the ground and I just tripped on it and now my foot hurts. Right. And so you keep going with number 3, just over and over. And then you can throw in some validation here, which is something I'll talk about later. If I go, oh, that would make me mad. And then silence, right? And so, like I said, they want to feel it. And so a lot of times they'll be like, she's like, I'm gonna go talk to him right now. I'd be like, oh, okay, what are you gonna say to him? I'm gonna tell him he needs to pick up his toy so I don't trip on him. Oh, okay, all right. Are you gonna say it mean like that? No, I'll probably say it a little nicer. Oh, I think that's a great idea. Can I go with you so I can see how good you do this? The situation diffused. So, and I know when I say these things, we're going to do a lot of examples today. You're going to be like, yeah, that sounds really easy in a box right here, not in the moment. And I totally recognize that. But I promise you that this system here really does diffuse things pretty easily sometimes. So then the 4th step is if the 3rd one didn't work. Okay, so let's say she's still just like screaming and crying and says, I want it to not hurt right now. And nothing you can do can make her happy, right? So this one is really good for little kids. Teenagers are probably just gonna look at you like you're crazy, but it might work for some teams, but it's really good for little kids. And that's to give into fantasy on this. So if I've said, hey, tell me more, like all this, and she's still just losing her mind and she says, I just want it to stop hurting. That's when I say, oh, I just wish we had a magical unicorn who could come here and who could just fart all over you and make it better. And now what's she doing? She's giggling, right? That's silly. That's ridiculous. And so she starts laughing a little and she says, it still really hurts. I said, I know, but what would we call our magical unicorn? And her mind's already gone. Distraction technique's really effective in these toddlers. She already thinks it's hilarious that we are talking now about a magical unicorn. And like I said, you're going to be surprised at how effective this can be, like when you start giving into that. And even if they keep going, like if you just keep building with the fantasy, a lot of times it is going to be pretty effective on that. So then into our tips. So tip 1 is that questions are your friend. So I don't know if anyone else loves Ted Lasso as much as I do, but I think it's a fantastic show. And I love this quote for so many reasons, for humans, but also for parents. So this is a really good place to start, which is be curious, not judgmental. Okay. So curiosity on it, rather than putting your own interpretation of events, is always going to be more useful in situations when it comes to children. So I'm going to give a couple different examples about the question thing, because this is a kind of overlaying recommendation, but for a couple different reasons. Like there are different situations it can be really useful in. So when a child is really upset and angry, when they are in stress response, we'd already talked about they're in the amygdala, right? So they're in that part of their brain that's just not thinking rationally. And so our goal is to get them out of that. And like I said, this goes for all ages. So the toddler that's screaming, the teen that's really mad at you because, I don't know, you're not letting them go to the party or something, they're in amygdala, they're mad, they're in defense mode. So how do we get them out of that mode? And so we want to get them to one of the other brain parts, okay? A question is the easiest way to do that, because a question is going to take them to either memory, if you're asking them to do something to remember something, or it's going to take them to decision making, if you're asking them to like make a decision or think about something, right? So if we go from mad, 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 and I say, oh my goodness, what was happening right before this happened? Memory. We're back in memory, right? Or if I say, oh my goodness, like, do you think that's a very nice way to say that? They're in decision making. Was that a nice way to say that? Like, I don't know. And this is automatically going to take them out of that part of their brain that has them so hyped up. The other thing is children really like to be in charge of a situation. Anyone that has kids knows that. So there's a couple little tricks with this one, and these are literally just word tricks. So one is to, like I said, with the question, rather than telling them what to do, ask them what they need to do, because now they feel like they're answering a question, like it's almost like they have charge of the situation. And so instead of saying like, you need to do all this before you can leave the house, say like, hey, what do we need to do before we leave the house? So not only are they thinking, they're not in angry mode, but they're also like, I came up with this answer, and so I'm in charge of this situation. Same thing with choices for kids. So rather than saying you need to go brush your teeth, right? And they're like, no, I don't want to. That's inviting them to say no, right? I will say like, hey, we have to brush our teeth and we have to take a bath tonight. Which one do you want to do first? Because they have this concept. I mean, they're going to do both. We know that, but this concept that they've gotten to choose, right? So they're in charge of the situation, and it makes them much more likely to follow through on it. The other thing is questions can be disarming. So not going to lie, full disclosure, I got this first one from a TikTok, but it was so good that I was like, this has to go in my presentation because it's just a good one. And especially I think for some of these kids that are perhaps coming from homes where they they just have a different expectation on how respectful talk is, for how they speak with adults and things like that. And I love that when you say a statement, you are inviting a response. Okay, so for instance, angry teen is where this kind of came from, where you say, you don't get to talk to me that way, or what are you doing, that is disrespectful, right? And then they can respond to that, I don't care, you're not my mom. Like, what do you say? You're inviting a response, right? Whereas a question doesn't really invite that kind of response. It doesn't invite a power dynamic struggle. So instead of saying, how dare you talk to me that way, when you say, who in your life made you feel like it was okay to talk to me that way? Where are you at now in your brain, right? There isn't a response there for a power struggle. They're not I mean, I guess whatever, they can be dismissive, but they're not going to have those power struggle responses, or they may even open up a little about it, right? There's even a chance here where they'll be like, who did teach me it was okay to do that? Regardless, you've disarmed the situation just by asking that question. This is another teen example, because I think this is a good one for these, but asking them to kind of think through those consequences too. So rather than saying like, weed is literally going to rot your brain, like, they know that. Like they don't need me to tell them that. And once again, a statement is going to require that response. But when I say, like, how does it make you feel? And do you think it's going to affect how you're going to play football? Like, there's not a yelling, angry response to that, right? Not like, you're not my mom, to that. It's like an actual request. And once again, where have we taken them? We've taken them from that amygdala, or from the like, get out of my face, to, oh, I didn't think of that, like decision making, right? Regardless, it diffuses the situation. So if you can remember only like a couple things, the question one's a really good one. So second one is I instead of you. So this one is pretty common in most communication courses. So marriage counseling, individual counseling, anything like that, because it's a pretty strong, very easy thing to quickly do in the way you talk to children and to teens. And so I is naturally going to communicate. I is a communicating word, whereas you is going to naturally get our trigger defense up, right? So I'm going to give you a couple of different examples on this one. So when I say, if I come in a house and I say like, you didn't do anything all day, right? How are you going to feel? Right? Like, yeah. And so I'm using my husband because I think that's fair to like say in these interactions. He's immediately like, are you kidding me? You're going to come in here with that? Like, defenses are up, right? Now I'm yelling, now he's yelling, and we're in a power struggle. Okay. But if I come in and I say, oh my God, I'm so overwhelmed by how much stuff is all around our house, and I just don't feel like I have time to clean it all, and it's making me feel like I'm a bad mom. Now, how do you feel? You're not mad at me, right? You're definitely not yelling at me. Yeah, you probably want to give me a hug if I'm going to assume right? You're feeling empathy. You're feeling, oh my goodness, like I'm sad for you and I want to help you with that. And that conversation is communicating very similar things, right? So when I came in, like, I'm communicating, I'm upset you did not do all these things. Only the first one is going to make you very naturally defensive, while the second one is not. So I actually give this advice a lot to not only parents, but to teenagers as well. And we'll kind of talk about like when I have a discussion with teens and parents later. But to give you some examples of kids, so like if a father wants his young child to stop calling him rude names, right? So he says, hey, no, if you call me that one more time, you're going right to bed. Don't say that word one more time, right? Sound pretty familiar? But if instead we try to take that I, like, ugh, I feel so sad when I hear those words. And I like playing with people that use nice words, right? So we've taken defenses down. The child's not like, oh crud, I'm in trouble and I'm ready to be defiant with you. And we've given that empathy of, oh, I don't want to make you sad, right? So same with, I said, like I talk to teens a lot about this too, how they can more respectfully communicate, because a good point of advice with teens is they do need some autonomy. They really do need like an ability to kind of have their own say on some things and have their own opinions. And I always say, but you can respectfully communicate that. And this is a good way to do it. So for instance, you've been telling him to do his homework like multiple times, right? And you're just nag, nag, nag. If he yells at you like, lay off me, you guys are always nagging me, you suck. And he slams the door, right? Now what's happening? You're grounded. I'm taking your phone. Power struggle. We're back in that. Whereas he says, I feel really frustrated and annoyed because every time you do that, it makes me feel like you don't trust me, right? Like I'm old enough to do this on my own. And so now what? You're not mad. You're like, oh, dang. Not only are you more likely to like listen to what he has to say and respect that, you're probably going to do what he asks, right? You're probably going to stop asking questions. So not only has teen gotten what he wanted, and that's what I always say, you're going to get what you want more times out of that, but we've avoided this whole argument that's happened back and forth. Woo. All right, use observational language. I actually think this is like one of the harder ones because it's a little, it takes practice. And I'm going to be honest, a lot of these take practice. So I know when I'm talking about it, it sounds like, oh my goodness, like she makes it seem so easy, right? Just talking about these examples and how does she do this in her everyday life? And the answer was I wasn't very good at it to begin with, right? So just like everything, this took a lot of practice and a lot of reminding myself and going back over like how we can change how we naturally want to speak to our kids and change it into something that's more effective. So observational is when you are observing what is happening. And this is what I said earlier, not putting your spin on it, not on what you think it is. Okay. So for instance, like, oh my God, how many times do I have to tell you to turn off that bathroom light? Right? Where are we at? Defense. And do you think they're listening? Like, no, now they're just like, oh my God, she's such a nag, like all the time. Why'd she have to say that? Whereas if you give them time to figure it out on their own, so if you just go, hey, the bathroom light is on, like, what are they going to do? They're not going to stare. They're not going to be like staring at you do that. They're like, oh yeah, and they're going to go turn the light off, right? So now we've given them a reminder, and we've also taken away that power dynamic struggle. So once again, like I said, I love using ones with I think with spouses is because it's relatable. But if I come in, I say, would it kill you to help me with the housework? So not observational, right? I'm not observing what's happening in the room. I'm just saying something kind of accusatory. And so instead, if I say, it'd be really helpful if the table were set for dinner now. We've given like a direction. And once again, there's an observation, right? It would be helpful if that table was set. And kids are much more likely to follow through on that. They're like, oh yeah, no, that would be helpful. And can kind of go do that rather than feeling like you're making a big request of them. So, and like I said, these are I think difficult in their subtlety, but they are effective when you can get a grasp of them. And so, respecting a child's struggle or validating their emotions can be done with observation language. And so, this first one I really like because it gives an example of a well-intentioned thing we all do. Right. So all of us, our natural response, your kid comes in, he's really upset, he's really frustrated with his homework. And I'm like, hey, but no, come on, multiplication's easy. Let me help you. Here, come here, let me show you. Right. So we think we're giving like good thoughts, right? But remember I said that kids are going to interpret things a little differently. So what we have done here is we have said that multiplication is easy, but maybe he doesn't feel that way. And so the fact that you've said is easy is just going to make him feel dumber. Does that kind of make sense? Where he goes, great, it's easy for everybody but me. So when we say here, I'll show you, it's saying, I don't think you can do it. Does that kind of make sense how there can be an underlying language there for kids? And it's with full good intention. No one goes in wanting to do that. So where you can instead validate is just by observing what they're feeling, right? So, oh my God, this is like just so difficult and I'm never going to get it. I'm stupid. And you say, oh yeah, multiplication can be really hard sometimes. And so they will let you know if they would like to invite more input on your part. That's where that silence comes into part. Yeah, it can be really hard sometimes, like, yeah, it really can. Do you think you can help me with it? And now we've, given them an opportunity to feel good about themselves, not the other way around. So like I said, playing into that when they say, I'm so stupid, I'm so stupid. And we say, no, you're not stupid. Don't say that. Don't say that. When we say that, we're invalidating them, right? We're saying, like, yeah, I mean, like I said, natural response. That's what I want to say too. But when we say that, we're saying your feelings aren't valid, right? So you can instead just observational. Like I said, I'm not putting my skew on that, which is that you don't need to feel that way, right? I'm saying you don't need to feel that way. You're not stupid. That's my feelings. But if we then just say, wow, those seem really hard to have, or even back to one. So like I said, you can always go back to that initial diagram going, wow, you just look really sad about that. Right. And that invites that conversation where we can then have a conversation rather than and allow them to deal with their emotions rather than us trying to deal with the emotions for them. Does that kind of make sense? This was a good example from the book. I just like putting in here because it had a twofer where I could show two things. So, if like your 10-year-old is to come to you and be like, I think I'm going to babysit, and, I'd be like, oh, honey, you weren't old enough to babysit. No one's going to hire you. You got to be at least like 12. How invalidating that can be, and instead be curious. So back to Ted Lasso, remember? So there's just no reason to give them that, right? So instead be like, oh, you want to be a babysitter? Tell me more about that. It's probably going to go into a conversation that lends in with nothing about actual babysitting, like, and actually doing that. And you don't even have to worry about then, like I said, making them feel bad about it. So tip 4 is fill their bucket. This one's important enough to get 2 slides. So all children have an attention bucket, okay? All of them. So if you think about them having that bucket every single day, they need it full every single day. they don't care what kind of attention it is. So if it is positive attention, great, we're going to put it in there. But if it's empty and they go, I need that attention, they're going to go look for that negative attention. They're going to go out searching for it to fill that bucket with the negative attention. Okay. And that's where a lot of attention seeking behaviors come from. So this can come out from like, why did you just flick your sister? Like we were doing nothing. We are just sitting here, and they go over and they kick their sister. Or if you're getting ready for dinner and they throw food all over the ground. Some of these things that are just like kind of out of character where you're like, I don't even know what's going on here. They're looking for attention for that attention bucket. So an easy way to decrease those negative attention seeking behaviors is to make sure that that bucket's always filled with the positive attention. If it's filled with the positive attention, they're not going to go out seeking it. This is another one that takes a lot of mindfulness. So like I said, it's a practice behavior, and I definitely had to practice it for quite some time to see this start getting results. Okay. So this is praise for things you would not normally praise otherwise. So obviously, if they bring you a picture, you're going to go, oh, thank you so much. Like that's an obvious moment for praise, right? But this is things like I ask them to get in the car in the morning, right? I say, hey, we got to get to school. Can you please get in the car? And as I'm buckling, I go, thank you so much for doing this the first time I asked. I didn't even have to ask you twice. I really appreciate that. Thank you for helping me today. Something I would not probably have noticed otherwise. Or you put your PJs on all by yourself. She does every day. But still, like saying like, oh my goodness, I am so proud of you that you did that. You did that's a good job cleaning up that crayons and markers and all those things from that project all by yourself. This is another one with observational language. So that's why I said the observation one is subtle, and you'll find it like in different examples. But rather than just saying good job, which doesn't give like a lot of like good job on what, like now I'm just confused. I don't feel good about myself. I'm just confused. When I say, oh my goodness, look at this. You had crayons, markers, and paper, and you cleaned this all up yourself. And now the table is so clean. Thank you so much. So and just some examples for how you can do that. This also gives children that perhaps have been placed in roles or placed in stereotypes a chance to see themselves differently. And I think this is another good one for kids that are coming from homes that may have been more on the chaotic side. So when we take that troublemaker and we ask them to be the helper, so we give them a new role, we give them a responsibility that lets them see themselves differently. So saying, hey, I have to go start cooking dinner, and you are always so good with the dog and such a good helper with him. Can you be in charge of making sure he's like fed and let out while I do dinner? Oh, thank you so much, bud. That would be a big help. You've given him a chance to like redefine that role. Same thing with that hyperactive kid, right? So if you have the kid that's always bouncing around saying like, hey, it's the toddler's nap time and she's really hyped up. Can you help me come up with some ways that we can maybe calm her down? Which is a question that help calm her down. And that they're going to respond, oh yeah, should I read her a book? Oh my, fantastic idea. What a good helper you are. Can you help me by reading that book calmly? And we've not only gotten that kid to kind of calm down, right? We filled their buckets. And so now they're getting that positive attention. We've given them validation, and we've given them some confidence, right? So lots of good things. Like I said, it's important enough for 2 slides. That's the validation one. It goes a long way. So validation does not have to mean agreement. And I always like try to emphasize that. That does not mean you have to agree with the behavior. And it shouldn't be a lie. It shouldn't be something that like you're saying just to appease them. So some examples is, I'm really sad that you're upset right now. That's true. Like probably, right? Like most of us don't like seeing kids sad. So I can be sad you're upset and still punish you for the thing you did, right? So you can validate why they're upset. They're screaming and yelling because they're upset, right? And I totally get, you say, I totally get why you're sad right now, right? I can understand how frustrating that is. Yeah, no, I would be frustrated too. Timeout. We're still going to timeout, right? So you can still validate that feeling and make them feel a little more seen, while then emphasizing that whatever the consequence or something is still going to happen. So the teenage bucket is a whole different thing. And like I say, the teenage bucket's covered in spikes, right? So it can be a little hard to fill it sometimes. And so my best advice with teens on this one is to approach with caution. Okay. So in general, I advise to parents that the biggest mistake a lot make with teens is asking too many questions, or really trying to like insert themselves into the teen's experience. And teens need to process by themselves. That's part of that development of their brain, is they need time to process, and they need to have some autonomy over that process. So if the example I like to give is that a teen gets in the car at the end of the day and they're obviously upset, like something has happened, right? Mascara is streaming down their face, like they're in a bad mood. They just say, just drive, something's obviously bad, like happens there. Our natural instinct is to hover, right? Oh my, what happened? Are you okay? Oh my gosh, is it Mary? Did she do that thing again? No, I know you don't want to talk. No, you have to tell me what happened today. You're obviously very upset. how much stress are you feeling like just hearing me say all that, right? So we have risen that stress level to a point that that teen can't really handle. Like they were already kind of in that amygdala place, and now they're just putting up barriers all over the place. And so easiest way to do that is like I said, the more you respect that teen's autonomy, the more they are going to give you. And so what I would say is, oh, whew, back to number one. Remember I said it works with all kids. You look really upset, right? They do. They look really upset. And they go, I don't want to talk about it. All right. That's usually what they say. I don't want to talk about it. You say, oh, okay. I totally respect that. Okay. And if at any time you want to talk, I'm here for you. Just know that. Okay. And that's it. You've put the seed. Okay. You've put the seed. You've respected the autonomy, and then go home. Now you can check in later. This doesn't mean like every 10 minutes. This means like an hour later, knock, knock, knock on the door, and you can say, hey, do you want to talk yet? Like, is there anything you want to talk about? No? Okay, totally get. Just want you to know that I care about you, and then I'm here if you want to talk, right? And you close that door again. And the more you do that and the more the teen recognizes you're going to respect that you're not going to do that, eventually they're going to come out. I pretty promise. Eventually they're going to come out and they're going to go, hey, I'm ready to talk, because they're in control of it and they're inviting you in, right? And then we go back to number one, where we identify the emotion, validate, attentive listening, all those type of things. And you do that with the teen, okay? The other thing you can do is you can give these I just like these examples of ways that you can do observational. So remember I said observational language rather than like, you'll be fine. That's not observational, right? That's not something you're seeing. That's like your opinion is that things are going to be fine. And a lot of times teens are like, I'm not going to be fine. I just told you that. Like Jimmy is the love of my life and it's never going to be the same again. And they feel invalidated from you, even though you're like trying to be helpful. I totally get where that good intent comes. But you know, if you just say like, hey, you've dealt with really hard situations before, like observational, I've seen that. So I have confidence that you'll be able to manage this one too. This gives them that confidence boost, right? So you're giving more information, and it's like, yeah, I have dealt with those hard things before. And as well as not getting that invalidating feeling. Like I said, I get it's a lot. And if you guys are like sitting there like, oh my God, there's no way I can do all of this, I pretty promise you it gets easier with time. And if you remember like the tops of the tips, as you start doing them, you're like, oh yeah, no, this like plays into some of the ways that I've been talking or doing things. So this one is another one that I really like talking to families about. And in particular, I think is super applicable to foster situations. Okay. Because as a caring, loving, motherly individual, my instinct, if I did not know better, would be to take this youth that has been in crisis, right? A child that has been in some sort of violent home or something where they had, too many expectations or no expectations, right, of them. And I would want to give them as open an environment as possible, right? No rules. There's nothing here. You can do what you like. There's fun stuff here. Do you want this? Do you want that? Like, it's okay if we have a little bit of a struggle, and try to not hone them in. I would want to be kind of that squishy marshmallow, squishmallow presence that they could have. And that's the wrong thing to do. And I'm going to explain why. And I think it's going to make sense when I explain why. So if you think about going to work every day and how going to work, knowing what your job is, knowing what is expected of you, if that all went away, if every day you had a different job, but nobody told you what that job was, if every day the rules were different, and some days you got in trouble for doing something, but other days you did not, and you were never 100% sure which day it was going to be, how would you feel going into work every day? I'd be an anxious mess, right? Like all the time. Like that would be so stressful to me. So boundaries, expectations, which is a nice way to say rules, right? Actually decrease anxiety. Okay. Because they let you know what to expect. They make you reliable. They make you trustworthy. They make it so that you will follow through on what you're going to do. Does that kind of make sense? Hopefully. So we like boundaries and expectations. And so when I say that there are ways, really good, like better ways to go about setting those. And so the first thing I always say is you do not want to do these in the heat of an argument. Okay. So if you're screaming back and forth at each other and you go, that's it. Every time you do this, your phone is taken away for the rest of the year. I hate you. Throwing it at it. That is not conducive, right, to any sort of discussion on the two of yours parts. So I usually say having a boundary expectation discussion should be picked. Like you should pick a time to do it, and it should be in this like non-threatening, maybe even enjoyable environment, like having ice cream. When I did it with my son, and I'll kind of talk how we did it, and he's 7, so that's why I said this is for like all ages. We just did it at the kitchen table. I was like, hey, bring some paper over, and we're going to kind of talk about your new chores and like what our expectations are. And so with that, then it should be a respectful conversation, especially with teens, not a list of demands. Okay. So it should not be like, you're going to do this and you're going to do this and you're going to do this, right? That's not going to be received well. And so instead, like I said, respectful conversation. And so I'm going to go exact example of what I've done with my son. I'm going to be like, so mom and dad think it's a reasonable expectation that you're going to do your homework every night. Do you think that's reasonable? So that goes to the next one. With soliciting feedback. Okay. So they're part of the conversation. It's not, so do you think that's reasonable? You know, and you'll find that most kids are reasonable, you know, kind of like, yeah, of course, it's my homework. I say, perfect. Okay, awesome. I'm going to write down. So homework done every night. If we don't do our homework, what do you think is a reasonable punishment for that? Now he's 7. So, right. So sometimes he'll come back. I go to bed 5 minutes early. And I'm like, 5 minutes? Do we think that's going to help you remember? Like, do we think that's an actual punishment? And he's like, no, I guess not. And so I'm like, okay, do you think we can think of something maybe a little more effective than that? What about 30 minutes? Perfect. I think that's a great idea. Okay, to bed 30 minutes early. And I write it down. This is hanging up in our kitchen. Okay. And I write that down. And then when we're all done, I go, okay, now what are your expectations of me, buddy? Right. So as your mom, what do you think I should be doing every day? You know, and this a conversation can take like the same thing where he's like, I think you should make me ice cream every day. You know, I'm like, do we think that's really reasonable, bud? Like, is that a good thing for a mommy to do, or should I be trying to make you eat healthy foods? You know, and so you can kind of have that conversation, but you know, he'll be like, well, I think that you should help remind me about my homework every day. And I'm like, yeah, I think that's totally reasonable. I'm going to write that one down. And so that conversation, like I said, doesn't then have to be escalated into an argument. And then later, when it comes back into play, it's not only going to feel a lot more fair, right? Because that expectation was set ahead of time. So it's not like they didn't know that was an expectation, rather than in the moment of something you assumed they knew. So to give you a really good example of this, I mean, kind of, my son is just really manipulative and smart, where I come in and the sister is crying and I'm in the car, like we're getting ready in the morning. I go, what happened here? And she's like, he hit me. And I'm like, did you? He's like, well, I didn't know I couldn't hit her in the car. Okay. You know, that's something I assumed he would know. But in fairness, I go, okay, I think you probably did know that. But let me set the expectation again. We will never hit our sister anywhere, right? Where you can then redo that. And then, like I said, even with teens and stuff, like when the time comes, I'm not gonna say it's easy. Like it's not like they're never gonna be upset about it. They'll be upset about it, but they won't give you an argument about it because they knew it. So if you're like, hey, your grades are down to a C, just like we talked about, remember it's written down. I'm gonna take your phone away today. Okay. I know that sucks. Validate, right? I know you're really frustrated with that, but that's what's gotta happen. And so it's just going to take a lot of the tension down around those. And then choices and timelines, this kind of goes back to giving teens autonomy, especially. So choices is a way to trick them into thinking they have that decision making where it was like theirs, that control. So like, do you want to do this or this? Timelines are really good for teens because it gives it gives them the message that you trust them to like kind of manage their own time and make their own things, and also that autonomy. So a good way to say that, you know, would be like, hey, like if we're gonna, like, you need to mow, my expectation is that you're gonna mow the lawn once a week. What's a reasonable timeline for you to do that? You know, and he can be like, well, I can't do it on Fridays because I have swim practice or whatever it is. How about if I have it done by Sunday? Fantastic. I think that's a great idea. So you can kind of get that solicited feedback from that. Oh, so I told you, we'll practice. Don't worry. I gotta keep an eye on the time. Okay. So you just walked in and your 5-year-old's colored all over the walls, crayon everywhere, right? What's our usual response? Oh my God, look at the mess you made. This is gonna take forever to clean up. So go to your room. Just go to your room right now, right? That's our usual response. And what are you gonna get from the kid with that? Fight, flight, freeze, like, right? We're gonna get a stress response. So you're either having the kid screaming back at you, they're going to be crying, or their head is down in their lap and they're refusing to look at you, right? So let's try a different approach after everything we've learned today. So we walk in and they've colored all over the walls. So observational and eyes, okay? Oh, wow. This is not what I was expecting to see when I came home today, right? And then another observational, like, oh, okay, bud, we draw on the wall or on the paper with our crayons, not on the wall. So not accusatory, right? I'm not yelling. I'm saying, like, I'm saying, this is what we do. This is our expectation for here. Can you help me understand why you chose to draw on the wall? Like, what was going through your mind when you decided what you wanted to color? So that's question, right? So I'm sure the child, when he first walked in, was like, ooh, what's about to happen, right? I'm ready for stress response for that. But now we just asked a question, and now they're like, why did I do that? Like, what was going through my brain then? Right? So keep going. Well, these pictures certainly are beautiful. Filling the bucket, right? And I love it when you draw me pictures. Filling the bucket. I don't want the walls to get ruined though, right? Observational and eye. So I don't want these walls to be ruined though. So next time, do you think it would be a good idea for you to color on paper instead? So expectation, right? So you assume they knew they couldn't draw on the walls, but maybe they, I mean, if you set the expectation ahead of time, different, but they didn't, right? So now we're setting that expectation. Next time we need to color on paper, right? So then, all right, perfect. Now that we know we aren't supposed to color on the walls, what should happen if we do it again, right? We're setting that expectation so that next time they don't argue when we do have that punishment, and hopefully they won't do the behavior again. And you go, oh, I think that's a great idea. So filling the bucket, we've done that like 4 times already, even though it's a bad thing, right? So a bad thing has happened here, but that doesn't mean that we can't still do these positives in here. And then here we go, make them see the troublemaker to helper. Like, I know what a good helper you can be. Do you think you can go help me? We can go get some like buckets and we're going to help me clean these walls, right? Now, what could have been a huge blowout, which could have been this kid screaming at you, yelling, get in your room, and everyone's upset. Now you're both cleaning the walls, and we've avoided that, right? So let's practice again. Your child wants to play on their tablet. Who hasn't had this one, right? But it's almost dinner time and you say no, and full-blown meltdown. We've all had, I'm sure, experience with Mount Vesuvius kid, where like this is just, there is seeing red, they're screaming, they're crying, throwing themselves on the ground. There is no reasoning with them, right? So here's tip number 6. And I actually think this is the hardest part of parenting, if I'm being entirely honest, and that is controlling your own reactions. We have amygdalas too. Okay, so remember that. We have lizard brains too. And so our natural instincts tend to not be the best ones too. Okay, and children learn by observation. And that makes sense, right? We don't say that very often. We don't talk about it very often, but it makes sense. They do not inherently know these things. They learn by watching us. So if you're yelling because you're angry and frustrated, what are we going to expect them to do when they're angry and frustrated? They're going to yell, right? If we're physical when we're angry, if we grab them by the collar, if we slap their hand, what do we expect them to do when they're angry? They're going to be physical, right? So like I said, I think the hardest part of this is that of all of these is stopping your own response to things and then modeling what you want the child to do. Okay. So when you walk in or when they're having that meltdown, right, you got to do quell your own reactions. You got to take that deep breath. There's been a time or two I've walked in the garage and just screamed as loud as I could and then calmly walked back in so that they got the emotional regulation, right, from me. Take a deep breath. You speak evenly and calmly, and you're showing them how to regulate their emotions. Okay. Like I said, hardest part of parenting. The other thing I think we don't do enough in modern society is talking about our coping mechanisms. Like as parents, like we have them as well, and we feel like we have to hide them almost from kids. Like we can't talk about what we're feeling and what we're doing, but this is actually pretty detrimental because remember I said kids learn by observation. So if we never tell them what we're doing, how are they going to figure out that that's why we're doing it? So in this example, right? So this exact example happened in my household all the time. I had a very emotionally labile 7-year-old and he's screaming and crying and I let him do that. So that's another thing that I think sometimes parents will do well-intentioned, but in error is try to stop the screaming and crying. If he is showing an emotion, he is communicating his emotions to me. If he had the emotional maturity to sit down and say like, I'm frustrated with you, I don't feel like you saw my side on this, he would. but he can't, right? He can't. He's 7. And so his way of expressing that frustration is screaming and crying. And that's not inherently bad. And so I don't punish that, but I do have natural consequences. And I also incorporate these coping mechanisms into that, like talking about them. So we'll get to ignoring it in a second, but I walk away and then I come back after like 20 minutes if he's still screaming or crying or doing whatever he's doing. And I go, hey, bud, so you're allowed to be upset, right? You're allowed to be upset. But all this screaming is really making me very irritable. Like I'm really on edge and I'm afraid I'm going to yell at you when you don't really deserve it. Like I don't want to yell at you, right? That's not what we should be doing. So I have to get away from the screaming so that I don't keep getting upset. So I'm going to my room where it's quiet and I'm going to listen to some music and I'm going to read a book. And you have to stay here. Okay. You have to stay here because I need to go to my room to calm down for a little bit. And what we've done here is 2 different things. We have shown them that we have those emotions too, right? They're okay emotions to have, that there's, like I said, a natural consequence to what they're doing. I don't want to be here anymore. And then we've given them this coping mechanism. So we've said, like, this is what I do to deal with how I feel it that way. And hopefully next time he's feeling overwhelmed because his sister is crying and won't stop, he'll say, I'm going to go to my room to listen to music, right? Or to do that. Same thing with, when dad gets mad and he goes, literally, dad is very angry right now and he wants to punch something, but punching something is bad, right? So this is something that we're thinking, our body is processing, right? Dad is thinking, I want to punch something, but I can't punch something in front of my kids. But if we say that out loud, we're helping them understand like that's okay thoughts to have. And here's how we deal with that emotion. So instead of punching something, I'm going to go run, or I'm going to do jumping jacks. I'm going to do something else physical. So talk about your coping mechanisms out loud. So we're back to kid, right? Full blown meltdown. What do we do next? Wow, you look really sad. So remember, we have that top one of identify the emotion. I'm not sad, I'm mad. Oh, thank you for correcting me. So you're mad. Can you tell me more about that? You won't let me have my tablet. I'm mad at you. I can totally understand why that would make you mad at me. Observation, but dinner is almost ready. So can we think of something else to do before dinner? Question, right? So observation, they say, oh, I'm not telling them you're not doing this because I need you to go to the table and I need you to do all this. I'm letting him make his own conclusions with that. Like dinner's ready, right? And then that question is, what else can you do before dinner? Thinking, decision-making mode. We're going with super defiant here because I think it'll be easier to see how this keeps playing out. So that didn't work though this time. He just screams at you, I want my tablet. Well, I want a bathtub filled with cotton candy. And then you say, what? You say, no, I want my tablet. And I want a monkey with a funny hat to be in that bathtub with me. You get the idea on the fantastical, but let's say fantastical is not working. And now we're like full on screaming at you. Here is natural consequences and the I talk and observation. It makes me so sad that you're choosing to yell at me. So you're allowed to be upset, but I'm going to go cook dinner because I don't want to be around that right now. Right. And then we leave. This leads us to tip number 8. Reward the behaviors you want, ignore the behaviors you don't want. This is especially good for toddlers, but just as good for young kids and for teens. Okay. Behavior plus attention equals more behavior. Remember, back to the attention bucket. They don't care what kind of attention it is. Negative attention counts. So if you are sitting there arguing with them, that's attention. You are teaching them that that behavior is going to get them more attention. So praise is more effective than punishment. Okay. So an example I give in my office a lot with toddlers is tantrums, okay? So 2-year-old throws himself on the ground, screaming, crying, natural parent instinct, right? Oh, no, stop, no, come here. I'm so sorry you're so upset. Here, let mommy give you a hug, right? Attention, we've rewarded that behavior that we don't want. We don't want that tantrum. So instead what I do is I walk away. So kid throws himself on the ground, you walk away. After 30-ish seconds, they're gonna sit up, they're gonna sniffle, be like, where did you go? That did not work. The second they calm down, they sit up and they do that sniffling. Now I swoop in. Now I come in and I pick them up and I say, I am so glad that you feel better. I am so sorry you were so sad. That attention was given to the calming down. And what we have taught them now is that that tantrum will not get them what they want. The calming down will. And that's going to get them to go a lot faster to B rather than A. Okay, so if we're going to say then that no attention is the best way to ignore it, then the best way to give them to do a behavior change, so something different, is to give them a reason to do it as well as a reason not to, right? That's doubling up now. Now we're like, okay, now I have 2 reasons to do this. So I think picky eaters is a perfect example of this. Okay, so the reason, we have, I always say no substitutions. I'm a really big advocate of that because it just makes them think they have you are over you in the power dynamic. But if they sit down and they're like, I hate this dinner, I don't want this dinner, you don't have to have that conversation with them, right? And so you can validate, I'm sorry that you're disappointed about dinner. I am, but that's it. I'm done. I say, I'm sorry, you're disappointed about dinner. Well, I'm not eating it. Okay. Like, I'm not going to rise to debate on that, right? And so where that natural consequence comes in is they're going to be hungry, right? So that's a reason not to do it. Like, they're going to be hungry. And so the reason to do it then is that my kids get dessert if they eat their dinner. So I've given them a reason. So they know I'm not making them anything different. So if they're not going to eat it, they're going to be hungry. And without fail, at least half of the nights, my 4-year-old goes, did I eat enough for dessert? And I say, not quite. You got to do this. And she will shove whatever it is in her mouth just so that she can get to that dessert. And I don't actually care about that because that's fine. That's what she chose to do there. That's fine. And the stress at our dinner table is 0 now because they know I'm not going to give into that. The only caveat I give to this is that punishment should be for unacceptable behavior, but not when you're doing an expectation. Okay. So if we're trying to do routines, and this is another really good one for foster kids, if you're like, hey, we're working towards something, right? So the example I'm giving in here, it was when my 3-year-old, when she was 3 and was getting up every night to come get us like 5 times when she went to bed. Like, that's not a bad behavior. It's something I want to change, right? And so there shouldn't be a punishment for that because it's not a bad behavior. Like, she has a need she's trying to come get me for, but I don't want her to keep doing it. And so that's when we use the sticker chart, right? So if you stay in bed every night, you're going to get a sticker, you're going to get a lollipop in the morning, you're going to get whatever that reward is. But if she does get up, she just doesn't get the reward. Like, she's just not getting the sticker. So I'm not going to punish her. And that's the only kind of caveat to that one. This is another one that I is like an overreaching recommendation that can be kind of hard, I think, to do in practice. And it has like a couple different areas on it, but try to be more specific with descriptions. And so I've talked about this a couple of different times where, like, kids, if you say something like this is great or you'll be fine, like, those have underlying connotations that they will put their own interpretation on, and it's not always good. And so when you're specific, you're going to help give them like actual information for that. So another good example like this is, if you're good, you're going to get a treat. So first of all, what does that even mean? Like, what is good? Everybody's definition of good is different, right? So if you were to ask my son, good is I didn't knock over every display in the store. Like, that's good for me. Whereas my expectation of good is highly different. Same thing with treat. Treat to me is like a piece of candy. Treat to him is like 30 Pokemon card packs, you know? So you can have all these different interpretations when you do that. So instead, be literally as specific as you can. And I know this can seem kind of silly, but this also goes way back to boundaries and expectations decrease anxiety. So no child is ever going to hold against you that you were too involved on your description. Does that kind of make sense? So instead of like, be good and you'll get a treat, I say, hey, when we go in this grocery store, I expect you to stay by the cart. Okay. Don't touch anything. If you ask for something and I say no, you don't ask for it again. And if you can't follow these rules, we're going to leave the grocery store. All right. Reason not to do it. But if you do really good, you get to pick out dinner tonight. Reason to do it. Right. And they're a lot more likely to fall through that. Same thing with praise. Like I said, this is great. You'll be fine. Not awesome. Like, what a beautiful picture. They're going to be like, okay, but what's beautiful about it, right? And so instead, like, I love the colors you use with these flowers. Oh my goodness, it makes me so happy to look at this sun. Where did you come up with this? Now their bucket's real full, right? They're like, I'm awesome. I'm such a good artist. Look at all the stuff she found right with that. And then this is another one, like I said, for kids that have been in unpredictable situations, is a good one, is to describe new situations. Once again, they're never going to like hold it against you that you went over the top with this. So it is another one I talk about when going to the doctor's office, like, describe every single little thing. This is really good with autistic kids too, who are very thriving on schedule and knowing what's happening, or anxious kids that need to know what's going on. I'll go over the top. And like I said, it will not be perceived as silly as it feels when I'm saying it now, but where I'm like, we're going to get in the car. It's going to be a 15-minute drive to the doctor's office. And when we get there, there's going to be a nice lady at the front desk, and she's going to take all our information. And then we're probably going to have to wait for a little bit. And then they're going to take us back to our room where we're going to meet Dr. Fischer, and she's going to look you over. She's probably going to listen to your heart, your lungs, look at your teeth. She's not going to do anything that hurts. She's just going to make sure we're really healthy. And then at the end of it, we're going to go get ice cream, you know, something like that. And the whole thing's going to take probably about an hour. So I know it felt kind of silly when I was saying all that, but what happened to that child is now that they were like, wow, I know exactly what's going to happen. My anxiety has really gone down on that, but they see you as a trusted source of that information as well, right? You didn't leave me to wonder. So let's keep practicing. So you walked away cooking. That's where we left us, remember? So he was screaming, I want my tablet. And you said, nope, that hurt my feelings. I'm ignoring the behavior and I'm cooking. Eventually he comes to the kitchen and he's just sitting there sniffling, right? So mine will actually like sit away from me, like, but like quietly sniffling. And I count that as a win and I just take it. So, you know, he comes in and I go, oh, I'm so glad you calmed down. I am really, really proud of you, right? So you're giving them filling that bucket and rewarding the behavior, which was the calming down. I'm still mad. Well, that's okay. It's okay to still be mad, right? Validation. But I'm glad you decided to talk to me about it rather than yelling about it, giving them alternative options, right? And observation at the same time. Well, can I have my tablet after dinner? You know, that's a good question. And I'm really glad you came up with a different compromise on your own. So there we're giving like observational and we are filling their bucket. How about we see how dinner goes first and talk about the tablet after? Question. Now he's thinking, instead of being mad he didn't get the tablet, right? He's like, oh, yeah, I didn't say no. I didn't say yes either. He's going, oh, okay, I guess after dinner is better than nothing, right? Okay, sorry I yelled. Thank you so much for apologizing. I really appreciate that. So I feel like I put in here, what if it doesn't go that way? So like I said, I know in a box, it seems so easy, right? But let's say it doesn't do that and he ends up still screaming and crying. And now I hear the other one screaming and crying because he's thrown a plastic toy at her and it hit her in the head, right? Now we've crossed a line. So like I said, feeling emotions is okay. Screaming and yelling is an emotion. Hitting your sister is not okay. So we already had that expectation. I talked to him in the car, no hitting ever, right? So now I go in with observations. Remember, you can validate without agreeing. I really wish you hadn't have done that, right? I don't want to have to punish you, but you know you're allowed to be mad. You're not allowed to hurt other people. So remember when we talked about if you hit your sister, it's timeout time. And then it's a timeout. Everyone's gotten this one at least once, right? I hate you. Well, that hurts my feelings to hear. You can be honest about it, right? And I'm not sure I'm going to want to play with you later because of that, but we can talk when timeout is done. And so here's we come into consistency. This is the last step. We're almost done. So consistency is key. This is the other one. If you can only remember one thing, remember this. So consistency equals reliability, equals trust, equals safety. Responding the same way every time makes you predictable, which means they can trust you to do what you're going to say you do. Okay. And that makes children feel safe. When you have inconsistency, and when I say inconsistency, I mean you give in basically. So let's say in that exact situation, you said timeout is time for this, but he says, please don't do that, Mommy. I'll never do it again. Please give me one more chance. You go, oh, okay, fine. One more chance, or we're going to talk about this later. That's inconsistent. Sometimes you're doing it, sometimes you're not. Sometimes that's an expectation, sometimes that's not, right? And so when you're inconsistent, you are unpredictable. And unpredictability is going to make them anxious and it's going to make them feel like there might be danger. Okay? Your predictable and consistent behavior makes children feel secure. They shouldn't have to be guessing what you're going to do. Okay? A should always equal B. And then if you're going to say something, do it. So once again, this goes back to trust. Okay. So don't do things you can't follow through on. So if you say like, if you don't go to bed right now, you are never getting candy ever again. That's not enforceable. Right? No one can do that. Like you can't keep that word. And so it needs to be something, and it wasn't part of a set expectation was the other thing. It needs to be something you can do. So I'm only going to remind you once that remember, if you argue about going to bed, you're going to go to bed 30 minutes earlier tomorrow. Right? Enforceable. So you can follow through on that. You can be consistent on that. So, I almost forgot. I meant to put a slide in here where we talked about the other one. So the consistency is that you need to take that kid and you need to take him to his timeout. Okay. So you have to follow through on that. And I have on a slide somewhere in here that physical enforcement is okay. Okay, physical discipline, not so much. It's not effective and it sends the wrong message. Physical enforcement is okay. And so when I say that, like, I will definitely get behind Connor and be like, to your bedroom, and like start pushing a little bit where I'm like guiding him. But the whole time I'm doing it, I'm saying, like, I really wish you'd walk so I didn't have to do this. I don't want to hurt you, but we have to get you up to your room. Like, can you please help me with this? So like understanding those senses. So it's physical enforcement, not necessarily that. So I'm going to summarize really fast so we can get to like questions and stuff, but I just like this slide because it's all the stuff I've talked about just in a slide. So questions are your friend, I instead of you, observation language, positive attention, boundaries, expectations, control your reactions, coping mechanisms, reward what you want, ignore what you don't, be specific, and consistency is key. I'm going to give you a real quick rundown of a couple specific groups. Everything I talked about already was like all kids, all ages, really good for. Toddlers are a little different. Toddlers are little cavemen. Okay. They only have 5 emotions. They live in the amygdala. Like that's all they have. Okay. So happy, mad, sad, hungry, sleepy. They hit things when they get angry. They're little cavemen. Okay. Training a toddler is like training a dog. And I know that sounds terrible, but as I go through this analogy, you're going to be like, that's actually a really good way to think about it. Okay. So tone is important. So even if they can't understand the words, especially those that are pre-language, they understand tone, right? A dog doesn't know English. It knows you're mad. So for instance, hitting is the one I use this a lot. Like a toddler that hits is when they're hitting, I take their hands, I physically stop them. I go, no hitting. They know that tone. They know I'm not happy about it. I go, you stop it, you silly little thing. Don't hit me. Like, what does that say? That's a game. Now I'm definitely going to hit you. Okay. So tone is important. Be brief. They don't understand explanations. So if you're going to sit like a 2-year-old down and be like, when you hit mommy, it really hurts her feelings. And they don't get that, right? They don't have that maturity or that language to be able to have that understanding, much like a dog. So just be very brief. No hit. Don't hit. Be consistent. Same thing. The dog does not understand why it can't pee on the carpet. If I try to explain it to him, it's not going to understand that, right? But it knows if it does, I'm going to smack its butt and I'm going to put it outside, right? And so even though it doesn't get why, it's going to stop doing it. It says, I don't like this. I don't like that I'm getting this other action from this. So I'm going to stop doing A. So same with toddlers. They may not understand why they're not supposed to hit, but they know they're going to be put in timeout if they do. So they're not going to do it anymore. The other thing with toddlers, 10 1-minute timeouts more effective than one 10-minute timeout. Think of them like goldfish, very short attention span. 10 minutes does nothing. Now they just feel abandoned. Okay. And so very quick, like frequent, consistent ones. So they hit 1-minute timeout, take them out. They hit again, 1-minute timeout, take them out. They hit again, 1-minute timeout. Kind of makes sense. So rather than 10. I just love this. I can't remember which book I read this in, but it cracks me up. We don't negotiate with terrorists. Okay. This is a benevolent dictatorship, not a democracy. So, in other words, like, don't let them rile you up. So, that food one I gave earlier is a really good example where, like, you don't have to enter the conversation they're trying to get you in. I hate chicken. I'm sorry. I'm not going to eat it. Okay. Like that's it. This isn't a discussion. Like that's what this is up for. It's very good with kids, with toddlers. And then also toddlers are gamblers, so giving in only reinforces the behavior. They will hold on to that for so long. They'll be like, okay, but that one time I screamed and kicked in that store, I got candy. And so if I keep doing that, and maybe even if I escalate it, maybe I get more candy. And they're going to keep doing it over and over again. So you undo so much good that you've done. Like you've done 10 times that you were super consistent, you were super on it. And then that one time you gave in, and they're like, aha, like I'm like, that is how I'm going to get them to give in every time. So I already talked about the physical thing. Oh, teenagers, a whole beast to themselves. But honestly, like we've talked about, they're just big toddlers from a neurological perspective. Think about it. Toddlers, cavemen, teenagers, kind of cavemen. So they really live in that amygdala. These are just some general advice on like, don't judge. Assume they have a reason for what they're doing. Observational language is really good for this. So not like, why did you do that? Or what were you thinking? Those are like judgmental kind of tones, or like, or I'm trying to think of another good example, but instead, observational, like this could have gotten you expelled, right? That's observational. So instead of like, oh my God, what were you thinking? This could have gotten you expelled. And then once again, I already gave the examples earlier. Don't assume you know it was wrong. Okay. So we might be like, did Mary do, is it blah, blah? Like, they're like, oh my God, like stop. Right. So use those open-ended languages and keep coming in. So exactly. Rather than like, are you being bullied? Tell me what's going on. Like if you think that, just saying like, hey, I'm worried. You're not acting like yourself, like observational instead. See, notice recurring themes. Supportive presence, not a nag. Support their autonomy. If they don't want to, just keep checking in on them. So we kind of talked about this. And then pick your battles. You got to give them wins sometimes. So like if it's not that important, then leave it for the important stuff. Because if teens feel like they're constantly losing, they are never going to re-engage again. And so if it's something that you can compromise on, try to find a way to do that. So choices can come into that. So let's say you have like a teen that just won't come out of the room, right? They won't come eat with them, saying like, hey, like, do you want to eat with us today or tomorrow? Right. So like being like, hey, we have this like choice here, but you're picking your battle tonight. You're not going to force them to do it tonight. The ADHD child. So these are just good advice for like how to get them to follow through on things, or things that will help you just make them more successful in what they're trying to do. So if you think of what an ADHD child, that they do not have attention span and their brain does not hold on to information. Just think of it that way. Think of it going whoosh, whoosh, right out. Okay. So our goal is to help them hold on to that. So 1 to 2 directions at a time. You can't be like, hey, go upstairs, get on your shoes, grab your book bag and do this. Whoosh, whoosh, gone. It's out. Okay. Hey, go upstairs, get your shoes. That's it. Okay. I love a timer for stuff, because if you can give them like a set amount of time, they can focus for that long. So part of ADHD is actually hyper focusing when they're motivated. So if I'm like, hey, can we read for 5 minutes? I'm going to set the timer. Okay. And then afterwards you get 10 minutes of Minecraft, right? That is really going to be motivating for an ADHD child. Using wait time. So wait time is a 3 to 7 second pause after you say something. So once again, neuroatypical children take time to process sometimes. Okay. So either something's gonna go in and out, or it's gonna go in and sit there for a while until it finally clicks in for them. So giving just a couple seconds after you say requests can help him follow through with it. And then I make my kids say everything back to me. He hates it. Where I go, I just gotta know that you know what I said, right? So can you tell me what I just said in your own words? He's like, I know, you said to go upstairs and get your shoes. Fantastic, thank you. So not only does this make sure that they heard you, but it makes them say it. And when you say something, it puts it in your brain 3 times, right? I had to think it, had to hear it, had to turn it into words, and had to say it. So you're more likely to remember it. And then just being really specific. So saying like clean your room is really overwhelming for an ADHD kid. Saying, hey, can you put your laundry away? Can you pick up the trains on the floor, which apparently is trams on the floor? We'll fix that later, and make your bed. And then visual cues. So like chore charts are really good for ADHD kids, or showing them, can you do the table just like I did this? So they're much better at like visual learning. And then using physical activity to help with their hyperactivity. So like, hey, it's a bit much right now. Can you do like 10 jumping jacks real quick? Whew, get that energy out. Okay. Can you do this as fast as you possibly can? Things that will have them use their physicalness. Oh, I promise I'm going fast. We're almost done. Okay, depressed child. I get this all the time. What do you say when they say I want to kill myself? Right? Like, where they're like, how do you respond to that? So the response should be as if you take them seriously, even if you don't. Okay. So even if it's in the heat of the moment, like even if it's like, you're arguing, you took away their phone, they're like, oh my God, I'm just gonna kill myself. You stop. Okay. And that is a whoa, that I take that very seriously. Like, I really care about you. And if that's genuinely how you're feeling, we need to do something about that. Okay. Do we need to go to the hospital right now? Like, is that where we need to go? We should probably look in your room and find stuff that you can't hurt yourself with. No, I don't want this to happen, because it's going to make them really take a step back. And it tells them that they're that's a serious thing to say, right? Like, we shouldn't be saying that in the heat of the moment if you don't want this response. And B, that you care, right? You're dropping the conversation, you're dropping the argument because you want to be there for this. They almost always walk it back, right? So when you start doing that, no, okay, I didn't mean it. I didn't mean it. I didn't mean it. I just said that because of that. And you're like, okay, are you sure? And it honestly kind of diffuses the argument at that point anyway, once you've gone into that. Now, if they really do say, yes, I really am going to kill myself, like, take them to the hospital. But a lot of times it's said in utterance rather than that. I love a safe word. I talk to my depressed teens about this a lot. And it goes back to the not wanting to be a nag. So a lot of teens I find don't lean on their parents or their like guardians or people like that, because they don't want to talk about it, and like they're a little like, they just don't want to invite that in most of the time. And a lot of well-intentioned parents, like I said, same that I would be like, well, what's going on, or how are you feeling? Oh, and is this how? And they really like try to dig, and teens don't really want that. And so a lot of times they just want company. So distraction technique is very good for like depressive episodes. Like when you're really sad, if you're thinking all these thoughts and you're just alone in your room, that really spirals. And so a lot of times they just want distraction, or they want you around, but they don't want to talk about it. And so I always recommend that you guys have like some sort of safe word that you can say in front of people. So let's say you're like, have other company and you don't want to be communicating that's what's going on, but you'll know what it means, right? So hippopotamus is my favorite, but you just come out and you're like, the teen can be like, hey, hippopotamus. And to you, that means now, like, I need to extricate myself and just hang out with it. Like I said, it doesn't have to be like asking, and you can start with the other thing. You can say, hey, I'm here if you need to talk. Like, I'm not going to force anything, but I'm here if you need to talk. And then be like, do you want to play a board game? No? Okay, what do you want? You just want to watch TV? Okay, let's go watch TV. And you're just hanging out. Okay. But that presence is really going to provide a lot more comfort than you think it does. Basic safety planning for the depressed child, if you really are like concerned about it, or you have a kid that you need to be worried about, you don't have to tell them about this. So especially in like a foster situation, if they've disclosed that this child probably has like suicidal tendencies or has tried to hurt themselves in the past, don't bring a big deal to the kid about it, because like it's just going to make them feel bad. But these are things you should probably do in the background. So locking up all the medications. The number one way kids try to kill themselves is overdosing on meds. This includes like Tylenol, ibuprofen, different stuff like that. If you don't have a safe or something like that, a place you can put a bike lock on is really good. So if you have cabinets that have like the little U's, I love a bike lock for that because it's really easy to then just undo. But having them locked up, and especially if they are truly actively suicidal, you may need to give them their medications so that you can have them safely. Or you can do something like a pill box that only has a couple in each, because most meds cannot be overdosed on with like 2 or 3. Most it's when they have access to the whole bottle. So just have the whole bottle somewhere. Then self-harm is the other one that's really common. And so just having like, and I'm not saying like all your knives have to be like, that's hard to do, like be behind something, but the kitchen's not where they're going to go anyway, because it's public. And so they're not going to be like, excuse me, when I get this knife to go cut my wrists. Like from that, most of the time they're getting like scissors or razors or something like in there. So just having those not accessible. And then no locked doors just being a policy in the house. So it doesn't, and that doesn't mean no privacy, and emphasizing that, being like, it's not no privacy. I just need to be able to like check sometimes to make sure you're safe. So, it's always like a knock, like, hey, everything good? Poke my head in, and then you go back. I just thought this was a really good graphic. This is actually from the AEP had like a handout I found that had this on here that talked a bit about the abused child. And these are just good ways to show like how you can try not to make them feel even more threatened. I do this in the office all the time. So I always do my exams from the chair because I'm tall. I'm like 5'9", so I'm tall. And when I'm doing an exam at a child, that is much more intimidating. And so I do my exams sitting in an office chair where I'm like at them and I can actually see them and interact with them. And then this is, like I said, the ignoring thing with abused children is particularly difficult because they're already dealing with some abandonment issues. So this kind of goes back to the just sitting. You don't have to say stuff. Like you don't, you can be doing your stuff. Like I'll be doing notes, like sitting there just doing my notes and stuff and just have them right next to me. And just that presence until they're ready to talk to you and they'll let you know. This is another one I think was a good graphic to try to like remember what things you can do. So so let them know they're safe. This can be words, hugs, safe spaces. So once again, we can talk out our thoughts, our feelings, and our coping mechanisms. It's okay to say that. So, if they've just had a meltdown and now you guys are just sitting there, you say, hey, can I give you a hug? Just remember you're always safe here, okay? We're always gonna keep you safe here. Like you can kind of say those things. Same with routines. So boundaries and expectations decrease anxiety. I love this chart. Look at it later. So this talks about what a response in a child with trauma is going to look like and why it's going to be different from a response in a child that's not. And it has lots of good age graphics on it. So it's too small to read on here, but I really like it. So end result, we're here. Every child's behavior is telling you something, and you need to see that as information, not aggression. Okay, if you can just remember that in those really difficult moments, be like even though they're driving you bonkers with what they're doing right now, this is information for me. This is not their intent. Big emotions hide other big emotions. So it's never about the Tostitos, is what I like to joke about, because like it's the underlying problem, right? They're not mad about this. There's something else going on that we need to figure out. Thanks.